deputy commissioner for communicable diseases, and is a HIV advocate and really just an amazing person all around. He did a talk earlier this afternoon, and he was saying that actually when people are out in the open protesting, it's less of a concern if they all have their face masks and they're not, like touching each other and then touching their faces. What's more concerning, I think, to him is the fact that when people are getting arrested and then they're put in confined spaces and there's that physical contact that's happening. So really, again, it's just, we don't know for certain whether or not the protests are going to lead to a increase in cases in the upcoming weeks. It's going to take about 2 weeks for us to know that information due to incubation period, all of that. But we're hoping that as long as people are, taking their personal precautions and just doing their best to like not get arrested, that hopefully they will be able to keep safe and express, their voice.
Steve, may I ask a question?
I recognize Ms. Banya for the purpose of asking a question.
Thank you. I just had a Pauline. Do you know phase 2? Do you have any idea if is that the phase where restaurants can begin to reopen? I'm just curious. Yeah.
I don't know. I believe so, but let me just quickly check on the city, on the state's website. But also, I forgot to mention that test and trace. So now the city is encouraging everybody to go get tested. So if you are interested in knowing your status, you can go get a diagnostic test or an antibody test. And at H&H hospitals, it's all free. So if anyone would like to go, it really helps now with the tracing part where we can see where hotspots are sort of popping up and like try to stop that as soon as possible. So I think in the suppression phase, we really think that it's important that people go and get tested. Obviously, again, maintaining social distancing, practicing, personal precautions by wearing a face covering. So all of that. I am on the state's website. So let me.
And we should mention we have a major testing site at the Highbridge Recreation Center at Amsterdam Avenue and 173rd Street, which is open to everyone every day. I believe it's, what the hell is it? Is it 9 a.m. to 7 p.m.? No appointment necessary.
Great, thank you, Steve.
Is there a site with all the testing sites in our area?
Yes, so on the city's website, there is a function where you can go and just put in your zip code or your address, and it'll show you all of the testing locations that are nearest to you. The only caveat I think that someone caught earlier today, and I hope it's being fixed, is that it states that all the sites are free when in fact only, I think, H&H hospitals and maybe city MDs are free, but all the other private ones we don't know for sure. So we want to make sure people don't make an appointment at someplace else that's not an H&H hospital and then get charged. So I believe that the city tech people were like on it today to try and fix that information. So again, we just want to make sure that people are aware that H&H for sure is free. So all the other private testing facilities, we're not 100% sure. So that language is going to be changed.
But if you have insurance, isn't it required now that the insurance companies would have to cover it?
I mean, I don't know for certain. I'm assuming, I honestly don't know. So you would have to call your insurance company just to make sure, depending on your insurance. And then going back to Ms. Bonner's question. So for phase 2 opening, it's malls and then restaurant dine-in and on-premise service, large gathering event venues, gyms, casinos, movie theaters, and public amusements, so like zoos and arcades and things like that. So that'll be phase 2. I don't know what that time frame is for New York City. Again, we are on track for June 8th for phase 1, but I don't know when we can safely enter into phase 2 yet.
But to follow up on that, they'll have restrictions, like a movie theater won't be able to fill every seat.
Right, exactly. Yes. So I believe that the social distancing, the 6 feet, all of that, 50% capacity all applies for the future.
Do you think in the foreseeable future, there'll be a point at which we're going to be able to have concerts again? Even in that case, you're going to have to take out seats?
Yeah, I mean, I don't know. I mean, I'm hoping so. But yeah, I honestly have no idea how long the social distancing measures are going to take place. I think what they're looking for is to pass a time frame where there could be a quote unquote second wave of transmission. And then beyond that will probably be when people with many, many degrees will make that determination as to when we can fill concert halls again. But I mean, I don't know. Personally, I don't think I could ride the subway anymore without being just a little bit nervous.
Yeah. And if there
We
is a
can have
second wave,
concerts in the park.
well, that's my question. I don't know if we can or not.
Right,
It-
like outdoor venues, maybe like in outdoor airspace, like Jones Beach
Right.
Theater, maybe.
Right.
But like enclosed spaces where there are lots and lots of people all gathered together, I don't know what the future holds for that.
No, well, Sally put her finger on it. I am primarily concerned whether we can do it in parks.
Oh, right,
You
your
know,
other hat,
Right.
I forgot.
yeah,
Great
I know.
performances on PBS.
Yeah, right. But Pauline, my understanding is if there's a second wave, we don't expect that to happen until the fall. Is that correct? After the
Ye-
summer?
Yeah, no, so definitely after the summer. And then it just makes things complicated because, again, it's going to look and it's going to be around the time of regular flu season. So, again, it's going to be a lot. This is why contact tracing is so important. Because we want to make sure that we know when people are being diagnosed and we can reach out to their contacts as soon as possible to sort of safely isolate folks and then make sure that it doesn't become this community transmission situation yet again, like we're seeing in South Korea, where they lifted their social distancing rules. And then now we're seeing some upticks in cases again. So we really want to avoid that whole situation. And unfortunately, just based on the timeline, it's going to come right around our regular flu season. So our disease detectives have a lot on their hands to sort of to try and differentiate what's happening.
Listen, I just at this point, I just want to mention that that when I checked the DOH website earlier to see where we stand with respect to our 4 zip codes, and you know, I think there's something like 175, 177 zip codes in New York City.
Mhm.
So we're somewhere in the middle, like number 82 on the list of the zip codes, and in order of severity, I guess, is now zip code 40, which has 1,102 cases, and as of today, and per 100,000, 2,459 and 241 deaths, and zip code 32 is right behind it at number 83, although it actually has a much greater number of cases, 1,500, and has had more deaths at 259. And zip code 33 is at number 93 on the list, and zip code 34 is down at 127. But and I mean, all told, in this community, we've had looks like we've had somewhere over 800 deaths from COVID-19. And in terms of the rate of people who are testing positive, it's you know, seems to be averaging around 25%. 1 out of every 4 people testing who gets a test is testing positive. But but that's also Pauline, that's also to some extent the result of the fact that up until now, for the most part, people who have been tested are those who have had symptoms. Isn't that correct? I mean, it would almost seem as though the positive, the rate of positive tests should even be higher.
Right. You're absolutely right. Because we've only told people that if you have active symptoms to go get tested, you would assume that those people would, you know, the number and the rate of positivity would be much higher. And then now that we're asking everyone to go get tested, I think the issue with this particular virus as well is that a lot of asymptomatic people have been out and about transmitting disease without even knowing it. A lot of people, particularly young folks, really did not exhibit any symptoms, therefore didn't get tested, but then were, probably out there shedding disease and transmitting it. So I think this is why, now that we're in the suppression phase where we've sort of flattened the curve, we're at the tail end of it, that testing and tracing is even more important, because then we can get all those people who are asymptomatic, and then make sure that we reach out to their contacts so that everybody can get tested. And then if you need to, isolate at home or safely isolate at an isolation hotel, you have the ability to do that.
And
Can I ask Steve? Sorry.
No, 1 second. Let me just finish my little report here. So in terms of the breakdown by race, and again, these figures, I guess, are really incomplete, because we only have data for maybe 3/4 of the people who have died. But it's still pretty pretty interesting, I guess, if that's the word. So in 33.4% of the people whose race has been identified are Hispanic and Latino.
Right.
30.4% are Black / African American. 27.6% are white, or were white, and 8.5% Asian Pacific Islander. That's obviously somewhat distressing. I tell you, but in some other places, you go to maybe Chicago or Milwaukee, Houston, the figures are even much more out of whack than they are here in New York. And the total number of hospitalizations has been 52,528. Number of cases, 202,319. This is just New York City. We certainly have had our hands full. Daryl, question?
Yeah, just a couple quick questions. I know there was an effort like a couple weeks ago that started with the mayor wanting to hire contact tracers.
Yep.
I just wonder how that's going.
So H&H has taken over that part of the project, if you will. So they are actually they're doing really well in terms of hiring and getting people who speak the languages of our communities, really, culturally competent folks, because we know in particular immigrant communities are not going to want to have a phone call from the government and then start asking who your contacts are and then asking for phone numbers so that we can call them. So, it's really important that they're hiring locally from communities that are highly impacted, and that people can speak the language of folks and actually come from the community. So that's been a high priority for H&H. I can actually try and get more information for you, Daryl, on their hiring and how all of that is going.
Yeah,
that'd be great. And maybe Steve, we could get someone from H&H next time too.
Yeah, and actually, Pauline, if there is if there's a flyer or some information on that we can circulate to our community so that we can encourage people to apply.
Sure. Yeah, I'll find that online and I'll email that to you.
All right. Thank you so much.
And also, I just wondered too, as we start to go through these phases of opening, is there anything different that DOH is doing in terms of responding or tracking in a way the different cases, or is it just relying on the same numbers as before, with the number of hospitalizations, et cetera?
Yeah, I think what we're going to be doing, or what we're focused on, is the amount of people going to the hospital with pneumonia-like symptoms, and then really depending on H&H's testing capacity. And obviously we'll be getting testing information from every single, accredited lab in the city. So anytime anyone tests positive for COVID-19, it'll be reported to the health department. So I think we're going to try and make sure that reopening is at a slow and steady pace, so that we can really be able to be prepared to get that information And potentially, if we do see hotspots happening, that, the contact tracing will be able to sort of nip all of that quickly, so that it doesn't become this large scale community transmission again. But one thing to note, though, for stores, I believe the governor just announced that stores will have the ability to deny entry for people not wearing a face covering if they are unable to provide reasonable accommodation within their facility or store. So, Daryl, I don't know if maybe the Commission on Human Rights might be getting more calls about that particular piece. So just FYI.
Yeah, I mean, that's a good question. Funny you should ask. We had a meeting about that this morning. So yeah, I mean, obviously, I think there are going to be a lot of, criteria that people have for just doing, basic day-to-day tasks, and ensuring that discrimination doesn't happen during that period is important to the commission, as well as, like you said, trying to find a reasonable accommodation, and define what that means for each entity. So yeah, that is, I believe our agency is coming out with some guidelines on that early next week.
All right. Well, actually, maybe that should also be circulated to people. That's pretty good. That would be useful information. I was in a Whole Foods market a couple of weeks back where when one of the managers told a guy that the next time he comes, he's going to have to wear a mask, and the guy threw a tantrum like he was being denied his rights. All right. Any other questions for Pauline?
Yes, I had one.
Steve, I had some questions.
I did as
Okay,
well.
who was that? Sally who spoke first?
Yeah.
Barbara,
No, before you, somebody said something.
Yes, it was Sally.
All right, Ms. Fisher, could you go ahead?
Yes, my question is similar to Daryl's. I was quite concerned when the responsibility for contact tracing shifted away from the Department of Health and Mental Health to health and hospitals. And I know there was a lot of press that there's been a delay in hiring contact tracers. Was it essentially shifted, and then they hired consultants to we basically shifted to another agency who then outsourced it to consultants to hire contact tracers. And I wonder, because yes, we have this emergency now, but we're basically outsourcing the expertise. And as far as going forward as a city, when we have to do contact tracing, not only for this, but other infectious diseases, how is that going to impact, the resources that the city has as at its disposal?
Right. That's a great question. I mean, I think based on our perspective, we obviously would have loved to have kept the contact tracing portion of the work, but I think a lot of our experts from the health department actually shifted over into a task force to make the transition as seamless as possible. So it's been a really great working relationship between the DOHMH and H&H Hospital. So I think based on that, I wouldn't be too concerned as, a general member of the public in terms of how everything is working. But in terms of the hiring, I don't know for sure how that all worked out. I just know from our end, our leadership here did move some staff with expertise over to H&H to provide that seamless transition in terms of the actual operations.
Thank you.
Sure.
Barbara?
yes, I wanted to ask, in terms of outreach so that people get tested, are you reaching out through the channels that people communicate with? For example, specifically ethnic radio, such as Radio Wado or radio, that's what the KPAM, KPAT, which is ethnic radio. So, because this is what people hear, or Telemundo and such, so that people, this is where people more get their information more verbally and know where their testing sites and the importance of being tested. So that's my first question. In other words, these are not people who we really need to get tested, who get on the internet every day and cruise rather sophisticated sites like Department of Health. Radio Wado and Telemundo and such is where you would reach them. So that's my first comment. My second comment is, I don't see why there's any human rights or discrimination issue. In any restaurant, you can have signs, no shirt, no shoes, no service. And so certainly this is even more important, or more important health-wise than wearing a shirt and the shoes in a restaurant or in some other public area. So it to me is pretty straightforward, and it's an executive order from the governor. So it's pretty clear. My third comment was, I believe that the things of opening theaters and things is stage 3. It's not stage 2. Those things are still closed.
Yes, yeah.
Yeah. So
Okay, all right.
Steve, I had a question.
Hold it.
Oh,
Pauline, do you want to respond to?
I'm sorry.
That's okay. Yes, with
No.
regards to messaging, we definitely are reaching out to ethnic media, print media, all of that, trying to get this information to those traditionally underserved communities. But we are always looking for ways to reach more people. We know there's a huge digital divide. We know that, in particularly those who are elderly, immigrant, the immigrant population that are elderly have a really difficult time getting information. So we want to make sure that all New Yorkers have access to this information. And we are actually, our team is working with our equity folks to see what we can do to really close that gap and make sure everybody is accounted for and that everyone is receiving information in their own language in a timely manner, and in a way that they are able to receive it and utilize whatever information we want to share with the community. So
I was going to suggest, why don't you send a flyer out with every Meals on Wheels meal?
yes, that's a great idea. Yes, I brought that up to have a flyer sent out with all the DFTA meals that they're delivering to seniors. I believe that they were in discussion about doing that, and also at the DOE grab and go sites. So
Yes,
that's
yes,
definitely an option that has been discussed. And then we're also thinking about ways in which we can engage young folks who are very social media technically savvy, and how we can get them to sort of close that gap with their, elderly family members or neighbors. So we're really trying to think of every way in which we can get information out to those folks who can't use a computer or don't have access to the internet, or who traditionally just really don't want to hear anything coming from the government. So we really want to make sure that they're getting our information and hopefully being receptive to it.
Julio, are you on the? Can you hear me? Julio, are you there?
Hi.
Can we use the network of community doctors that the hospital is plugged into to spread the word about the testing as well?
Well, let me just say, in terms of testing, I had Espaillat's call yesterday. He has a COVID weekly call. And so we had Dr. Tayak, who heads the SOMOS, which is a network of community physicians. And according to him, he said that they have over 180 different sites within the community physician community who are in fact doing some testing. So they are getting the word out to patients in the community.
What about mobile testing sites? Might that work? Trucks driving to neighborhoods with people able to collect samples?
Yeah, I think there's a lot of discussion about mobile sites, and then also as the technology is evolving, having at-home kits that you could do at home and then mail in. So there are a lot of opportunities for expanded testing capabilities. I think in terms of like the mobile sites, I think the state actually has been the lead on a lot of that, working with organizations like Somos to like have pop-up locations in churches and other places that are quite large, so that social distancing can be maintained. But if you have any ideas as to where a mobile site could potentially be, please let me know, and I'll be able to forward that over to our emergency management team, where they're in communication with the state as to where we can have additional sites.
Perfect. Steve, that could be another parks opportunity.
Possibly, yes. Yeah.
I think
I mean,
Tanya had a question.
Yeah. My question for you, Pauline, is I'm really concerned about people not wearing masks. And as we start to enter these phases, and there's going to be more traffic out, more people out. I'm just really concerned about that. And I was wondering whether your agency is planning to do, I know they have this whole like state campaign and these videos and that whole thing happened, but I'm wondering if there's some targeted, like community targeted outreach that's being planned with your agency to really better educate people or reach them, because I'm just concerned that this is just going to get out of control, like as we start to open up.
Yeah, that's a great suggestion. I'm going to bring that back. I don't know if there is specific, I think in all of our guidance, we're wrapping around, make sure you have your face covering when you are out in public, and you cannot maintain that 6 feet of distance between you and another person. But you're right. I mean, this will only work if we get the cooperation of a majority, right? So let me bring that back and see if we are planning any specific targeted communications. I know we're doing a lot of campaigns and targeted campaigns to the neighborhoods that were testing the highest. So, I believe there were like 88 zip codes in which the mayor wanted to really focus in on making sure people got as much information as possible. But I think, having this cultural shift, if you will, of making masks a common thing is going to take some time. People will have to get used to that idea. But you're absolutely right that it's only effective if most people are following that guideline.
Can I jump on that for a second?
One second, please.
Okay.
I believe the mayor also announced that the city has about 2 million masks that it's prepared to give out to businesses and others in order to satisfy the need.
I believe, yeah, I think for the businesses, it's meant for their employees. If their employees are unable to secure a face covering for themselves. But I know that the mayor's office actually worked with parks to give out masks in parks when the weather started becoming really nice and more people were outside. And then we do have that program for social distance ambassadors, where there are like city employees who volunteer their time to go out and encourage people to maintain 6 feet of distance from other folks and to wear a face covering. So God bless those folks who are willing to go out and like confront people.
You can get paid to give dirty looks to people.
Yeah. Oh, yes, our ambassadors are out there trying to do the right thing. So be nice to them, please.
No, they're not looking for confrontations, but
No, they're not.
a lot of our employees who have been redeployed, from recreation centers and other activities which are not open at the moment.
Along those lines, can I just bring up just a question I have? Why not distribution machines? For example, we have, doggy bag poop distribution machines on the streets. And I'm not suggesting putting distribution machines on the streets, but I know like hospitals have them. We could put them, and this is for the public, because I think some of this is an ignorance. And I think some of this is actually economics. Masks aren't cheap. People, even if they have masks, they're reusing masks. So for a community, especially like ours, where people don't have the finances to buy the masks, if we could set up dispensing machines in locations where someone wouldn't come in and empty the whole box, like pharmacies and the like, I think that might make some sense in our community. In fact, I was going to bring it up later in the meeting because perhaps we could spend some of our community board enhancement initiative funds in piloting such a program.
Well, Sally, I do know too that the subway near my office that I haven't been to in many months is has a dispense machine. I think that CVS sponsors or something, like a vending
Right,
machine where you get Band-Aids and stuff like that.
Yeah. I mean, I think something like
Okay.
that makes a whole
Okay.
lot of sense, and they do it in other countries. Why not here?
Sure. Yeah, I mean, that does make a lot of sense. And I think also just along the lines of sustainability, we're saying that, cloth masks that you can rewash are also okay. So like if someone just doesn't have the funds to be able to buy boxes and boxes of surgical masks, that like there are other options for them as well. So you can make your own mask at home out of an old t-shirt and be able to wash that over and over again. As long as your mask is being cleaned and sanitized the appropriate way, reusable masks are totally fine, and we encourage that for sustainability reasons.
Now, can I ask a question about?
We gotta move this agenda along.
I know I wanted to do a time check too, but I just had a quick question. What is happening in the absence of cooling centers this summer?
Wait.
Oh, I think Fern was just talking about cooling centers.
Oh, okay. I'll wait.
And there's actually an announcement on the mayor's site apparently today soliciting interest from community-based organizations that might be able to provide sites.
Yes, so there is a lot of development on that. And then also with DIFTA and NYCHA, the city actually provided air conditioning to a number of seniors who were unable to afford an air conditioning unit for themselves. And so I believe that program already delivered the air conditioner, or they've already identified the folks in which these air conditioning units will be delivered. But it was quite a large number. I don't have that off the top of my head.
74,000.
74,000.
Yeah.
So yeah, so I mean, we really understand that the heat in the summertime, especially for vulnerable populations, is something to be very concerned about. So that was a program that we were really happy that we were able to have a role in distributing these air conditioners and really work with the state to provide relief in terms of electrical or like utility bills, to provide assistance with that so that they can run their air conditioners without worrying about how they're going to pay for it.
So
And-
can
and just for everyone-
comment on the cooling center, Steve?
Yeah.
Excuse me?
I just want to say a couple of things on the cooling centers.
Before you do, hold that thought.
Okay.
Was the distribution of the air conditioners, was that limited to NYCHA developments?
No,
Not limited, but a majority of those units did go to.
No. it wasn't. It was a third.
Oh,
A
a
third went to NYCHA and 2/3 were for community distribution. The ones that went through DIFTA, we just finished doing the surveys yesterday. So they haven't been distributed, but the people have been identified and the distribution is supposed to follow.
And West Harlem Environmental Action, We Act, is also working on a cooling system.
Yes,
initiative.
that's right.
Who will install these air conditioners?
The city.
Wow. And do you have a sense of how many are being distributed in Washington Heights and Inwood?
I can only tell you what our number is, which is we called 501 people, and we've identified about a quarter of them as wanting air conditioners and being eligible. So around 125 for us.
Okay. All right. very
How
good.
has the eligibility requirements changed from prior years when they were doing distributions?
It's not the same eligibility.
All right. So that's it for Pauline, right?
Just one more cooling center question.
Okay.
So Pauline, the commissioner at DIFTA said that DOH and DIFTA are working together on the guidelines,
Mhm.
because I'm really worried that we're going to get overwhelmed with the number of people who haven't even been able to come to the senior center and will now have a heat emergency and want to come in, and our maximum seating capacity is like 70, where normally it's 180.
Right.
So has thought been given to how that's going to be handled, how it's going to be monitored, and helping us to not have 180 people in there at the same time?
Yeah, I don't know off the top of my head, so I will definitely circle back with our leadership here to see sort of
Great.
what those conversations and guidance looks like. And then we might have to utilize, hopefully the MTA would be willing to, I know that sometimes they offer buses. I know it's not ideal, but in times of emergency, they have offered additional space for either cooling or heating. So, I mean, it's going to be something like that where we're going to have to make it work so that all New Yorkers are kept safe and that that no one suffers from any heat related injury. So I'll definitely get back to you on that, Fern.
Thank you.
Steve,
Okay.
the other issue that we have in Washington Heights and Inwood is, given that people are self-isolating and given that air conditioners are going to be running, what sort of impact is that going to have on our grid? Are we going to be facing brownouts and blackouts this summer?
Well, we could direct that question to Con Edison,
Yeah,
but,
that's who has to answer.
but I got,
7:51.
yes. Okay, Pauline, thank you very much again.
Steve, I wanted to make a quick comment. Have you
Thank you,
considered
Pauline.
have you considered expanding cooling centers to possibly some of the synagogues and churches, such as the synagogue that's at 189th and Broadway, and maybe Good Shepherd Church? They're very large, they're very cool, and you would be easy to socially distance people.
I'll definitely bring that back.
Hmm?
I'll
They-
definitely bring that back to our leadership team in terms of identifying other locations for cooling centers.
And the upstairs of St. Elizabeth's, because St. Elizabeth's has a senior center in the basement, but upstairs there's a huge church. So that, in other words, when you talk about overflow, that would be a natural place, at least for a few hours a day, right? From noon to 4.
It
Yeah,
makes
and
sense, yeah.
the Mount Sinai Synagogue is at 187th Street.
180, yeah, by the Key Food, 187,
Yeah,
yes,
yeah.
187.
Okay,
Great.
Pauline, I haven't broken the news to my committee members yet, but I'm going to ask them to meet again in July. So,
Yay!
I'm probably going to invite you back in July. So
I will be back.
Yeah, be forewarned. Thank you very much.
Great,
Thanks.
thank you.
All right, thank you again.
Bye, thank you.
Bye.
great.
Thank
Bye.
I can
you.
hardly wait. I can hardly wait, Steve.
I'm happy.
Okay, well, Columbia University has agreed to give us a presentation in July on a new mental health initiative growing out of the COVID-19 crisis. And I would like to get that presentation in July rather than wait till September. So we can discuss that towards the end of the meeting. But Captain Winston, who called in last month, stayed on the call for the entire meeting. I didn't even know he was on the call, so I would like to give him a chance now to talk to us.
Thank you. How you doing, Steve, everybody?
Okay.
I'm Captain David Winston. I have 35 years on the FDNY. I'm the commanding officer of Ladder Company 166, the other end of the city in Coney Island. So I'm doing community affairs from downtown, from headquarters, probably for the next year or so, as they put me out to pasture slowly. But meantime, I'm really into it and I'm interested. I actually want to get to know Washington Heights better, your community better. And I would like to establish a relationship with some of the extraordinary community organizations that I see represented here tonight and that I've seen, referred to at some of our district service cabinet meetings. If you have a pen or pencil and some paper, I'd like you to copy, if you would, my email address, and we can thereby establish rapport, contact. I'm looking to learn the senior organizations, the educational organizations in the district, and other community-based organizations, nonprofits, so that we can have a dialogue back and forth regarding fire safety, safety in the home, remote learning that we offer educators through the fire departments, fire safety education, and CPR instruction units. All right, so my email address is david.winston, WINSTON, at fdny.nyc.gov. That's david.winston at fdny.nyc.gov. And I would particularly love to hear from some of the nonprofit and community-based organizations in CB12. Does anybody have anything for me this evening?
Yes, well, yeah, David, maybe you didn't see the email that I sent you, but I should, number one, I should put you in touch with our Public Safety Committee, because they're more primarily concerned with the fire safety and the specific fire department related issues. Our committee is primarily concerned with EMS, with the emergency medical services, and you know, we have a what is it, EMS Station 13, I believe it is, at 172nd in Amsterdam, and we're particularly concerned about how it's been able to function during this crisis, and you know, how busy it's been and what the volume has been, and whether it's been able to maintain to the extent possible you know, reasonable response time, and put out the number of ambulances necessary to cover our area, considering the fact that a number of the paramedics and EMTs have you know, not surprisingly, been stricken by the virus as well, since they're since they have the first contact with many of these patients or the people. So we're really interested in and maybe if you're not prepared tonight, if we have, and I hope we have this meeting in July, you can come back in July and fill us in on where on how our EMS station has been you know, surviving during
Yes, on how they've been faring. I understand.
Exactly. Yeah. So so then maybe you want to come back in July and give us that kind of report?
Yes, sir, I would. I'd love to.
All right, very good.
Steve?
Where are you right now? It looks as though you're in some kind of outdoor patio or something.
Yes, exactly. I'm in a public park in Rome, New York. I've separated myself. I'm at a secure location, would be good to know. And the incidence of COVID-19 is much lower up here.
Oh,
so
sure.
I have the option, and I'm availing myself of a more, you might say, rustic or sylvan location, more rural location.
All right. Well,
you can see I'm not masked and I'm in public here, but there's no one else around. I couldn't do this in New York City, of course.
All right. Well, we'll give you a pass for that. So take a look at the email that I sent to you and see whether you can respond to that and give us a full report on how EMS Station 13 has been dealing with the crisis. Did Barbara have a question?
Yeah, just a quick comment. Dave, I'm also the secretary of the 34th Precinct Community Council, and we would love to invite you to, when we can start to meet again, or in some capacity, whether we have to go to Zoom or whatever, to have you come and give a presentation.
Oh, very good.
I'd love that.
Yeah, and we've had the fire prevention. We've had fire prevention in the past, and it was very, very well received, very well received. So I'll be in touch with you. We don't have to
Okay,
go into
but-
detail now.
Which
Okay, but-
precinct, community council?
What?
Which
34th,
precinct?
34.
34?
Okay, but if
Okay.
you're gonna do the 34th, you're gonna be obligated to also speak at the one for the 33rd.
Well, you've got to book them in, Steve.
Oh,
You have to get Maria Luna to book them in.
David, this is Sally
Yes.
Fisher, co-founder of Friends of Inwood Hill Park, and I'm also on the board of the Riverside Inwood Neighborhood Garden. Those could also be potential locations once we are able to do public events where we could do some of the distribution.
Yeah.
So
Oh,
I
that
think
would
I
be
might have
great.
met you at one of our general meetings, so I will be in touch by email.
Thank
All right.
you. I'm looking forward to it.
Well, Fern,
Yeah, David presented at Waikoa.
he did?
Yes.
Okay,
Yes,
So you-
I did. That's right.
all right, so you've already put him in touch with all the senior centers?
Yes. I don't know how many have been in touch
Yes.
since, but I know that one of our senior centers was.
All right, actually, David, I'm gonna maybe give you a call or talk to you separately. A couple of years ago, there was a fire in a building next door to mine at 775 Riverside Drive, where the fire resumed up from the ground floor to the roof through the, what the hell is that thing called again?
Dumbwaiter, dumbwaiter.
Thank you, the dumbwaiter. And I'm wondering whether or not the fire department has considered some kind of regulations that would require landlords to secure the dumbwaiters or make them fireproof or to do something, because that was a horrific situation where people couldn't move back for over a year or more.
Dumbwaiters are required to be sealed shut so that there's no access to them. But they don't have to be, there's no requirement that there be fire stopping inside the vertical cavity formed by the dumbwaiter.
Well, there's got to be some way to prevent something like this. Maybe, the landlord may have put in all sorts of wiring there, and then the fire spread, I think, through the wiring that otherwise is normally not there.
A dumbwaiter shaft is basically a chimney.
Yeah.
So fire will spread vertically, unchecked through a dumbwaiter shaft, all the way up to the roof and everything in between.
Well, when you get a chance, could you just check for me on whether or not the fire department is considering some kind of additional regulations to prevent a recurrence of what occurred at 775 Riverside? Okay, so we're inviting you back in July, I hope.
Thank you.
All right, Richard Taylor, are you still with us?
I am. I'm still here.
All right, very good. All right, so this is the first time we've ever had a presentation from Metro Plus. And you have a PowerPoint?
I do.
Okay, very good. And you're going to explain to us what Metro Plus is.
I definitely will. So first, I want to thank the board for inviting me to this meeting. And I've always been trying to get a relationship with more access into Washington. I grew up in New York and Lower East Side, and actually I'm very familiar with the Washington Heights area through my professional career. So I'm excited about getting the opportunity to speak today. Let me share my screen with you. Let me just go here. I'm assuming it's screen number 1.
Oh, it's curfew now.
Share. Can you see my screen now?
Yeah,
Yes?
yes, I can.
Yeah.
Okay.
But is there a way to make the it's not quite full screen. It's,
Let's see here. Nope. Full screen. Oh, I see. How's that? Is that better?
Yeah. I don't know. Is there any way to make it larger?
No, Steve, that's just the
That's
thing.
what it is? Okay. All right.
Yeah, I think that's what it is.
That's what it is. Okay, very good.
All right, so Metro Plus, who's Metro Plus? So Metro Plus, I'm not sure if you knew it, but we're affiliated, we're a wholly owned subsidiary of New York City Health and Hospital, which is the largest publicly held facility in the United States. And of course, the facilities are Bellevue. I'm responsible for the oversight of representatives that assist individuals enrolling into our health plans in the borough of Manhattan, which encompasses Bellevue Hospital, Harlem Hospital, Metropolitan Hospital, as well as some of the clinics in terms of the clinics that they have available. They're called them Gotham sites now, which are Sydenham in Harlem, Gouverneur down in Lower East Side, and La Clinicas de Americas, which is located in Washington Heights on Nagel Avenue. We've been in business for over 35 years.
Richard, could I just stop you for a moment?
Sure.
Don't we still have a child health clinic at 600 West 168th Street?
600 West 168th Street.
Yeah.
I'm not familiar with that clinic.
Oh, okay. I thought that was also yours.
600 West 168th Street.
Yeah, there's a Department of Health building on the corner of Broadway and 168.
No.
It's
I'm
not yours?
familiar with that one.
No?
Nope.
Okay.
So we currently have over 500,000 members in our plan, and we've been consistently ranked amongst the highest plans in New York for quality and consumer satisfaction. We're only located in the 5 boroughs of New York, so anyone interested in enrolling would have to reside in those boroughs. We cover a variety of plans in terms of Medicaid, which is no-cost health insurance, the Essential Plan, which is a plan through the marketplace, which is a $20 or zero copay for individuals who are interested in the plan. And then we have Medicare, which for individuals over the age of 65 or 38 and have a disability. Metro Plus Gold is our plan for the City of New York employees. Child Health Plus is for children under the age of 19, whether they're documented or undocumented. And then we have the qualified health plans, which are the metal level plans, which is part of the marketplace or the Affordable Care Act. And then we are one of 3 plans that have a special needs plan, which is a HIV plan, as well as a managed long-term care plan. Things in terms of updates that need to know. So the New York State of Health put in a special open enrollment period, a special period in which individuals can enroll into the plan up through June 15th. Usually the open enrollment period runs from November 1st to January 31st. Because of the pandemic, they wanted more New Yorkers to get access to health coverage. So the New York State of Health decided to open it up, and it went through April 15th, and then they extended it again through June 15th. So the difference between before the pandemic, we can now do telephonic enrollment since everyone is socially distancing. There's no physical location per se that you would enroll someone. So we enroll individuals over the phone. Also, it's important to know that there's a grace period so that individuals do not lose their health coverage. There was an extension for individuals that needed to renew their plan. So let's just say their plan was coming up in March or April. The New York State of Health decided to give a 4-month grace period so that individuals would not lose their health insurance. And also because of individuals have lost their jobs or seen a reduction in their income, there's also the possibility, the opportunity to get rescreened for health insurance, where you may have qualified for a higher premium payment plan, maybe something like a QHP plan, but you've lost earned income, and now your income is dropped, and you may now qualify for Essential Plan, which may cost you $20 a month, or you may qualify for Medicaid, which is no cost. We're still able to help individuals when enrolling. So we have assisters that help over the phone. We do free pre-screening for individuals. We answer questions with regards to general inquiries. How do I get my doctor? How do I enroll in the plan? We provide customer service needs, assist individuals in submitting their documents when required. We accept premium payments for individuals who are looking to make sure their insurance doesn't elapse. And we manage health, we manage pretty much remotely through our member portals, where we have telehealth services, where individuals who are members are interested in seeking the access to a doctor since they're not able to go to the office. There's the telehealth and the numbers displayed there. And as well as individuals can go through our member portal and get access to care in terms of their changing their cards, paying their bills, etc. So what are some of the benefits enrolling with us? You know, in terms of the Affordable Care Act, there are 10 essential benefits in which you get a primary doctor, specialty services, and as you can read or see on the screen, you get access to these benefits when you enroll in our plan. So the biggest myth is just, we want to debunk some of the health insurance myths. And so most people think, I lost my job, I can't afford a health insurance policy, what do I do? Well, consumers, they can reach out to us and the marketing representatives. In my region alone, we have 40 marketing representatives, but Metro Plus throughout the boroughs, we have over 200, we have 250 representatives, a very diverse team speaking a multitude of languages. Yesterday, I had one of my representatives who spoke at one of these organizations, and she speaks Arabic, Spanish, French, and English. And so we have representatives that speak multiple language. Also, we have a language line. So if anyone calls a representative, they're able to get somebody to translate through our language line. So there's an 800 number that can be called that's on the screen if individuals require assistance. We also have a virtual office on our website at metroplus.org. And when you go on the website, you can click on Manhattan and you'll see the representatives as well as their supervisors, their leadership who oversees them, and they can select a representative and make a call, and maybe they like the way the person looks or the picture and thinks the person looks like them and feel comfortable, and they can reach out and call the person. So here's myth number 2, I have a student visa, I can't get health insurance. So a lot of times students feel like they can't get health insurance, so they're 19 or 20 years old coming visiting the country. But that's a myth, because if a student has an F1 visa, they're eligible to apply for health insurance via the New York State of Health. We've worked in schools like Baruch College, City College, Hunter College, where we have marketing representatives. Prior to the pandemic, we had individuals working at marketing at those locations, assisting students with getting health insurance. So wanted to debunk that. And now individuals are no longer, there's a lot of job loss. And so we see individuals in the past would say, I can't provide a termination letter to the New York State of Health, so I can't apply for coverage. Well, you can. The state has relaxed a lot of the eligibility and document requirements for individuals to enroll. So they can now enroll into the plan, and at some later time, the state will collect the documents, but right now the state is looking for individuals to get health coverage. And representatives a month or 2 months later can say, you know, let me get this documentation from you. But right now the state is trying to get as many individuals on board as possible. Also, I didn't renew my coverage during the COVID crisis outbreak, and I probably lost my coverage. Well, again, as I stated earlier, all renewal certifications are currently suspended for anyone enrolled in Medicaid or Child Health Plus and the essential plans for the next 4 months. So individuals, besides having anxiety because of the virus, they can rest assured that they're not looking to get kicked off of a plan, because the state has provided a 4-month grace period. So since this started in March, it goes through April, May, June, July. The state has allowed them a grace period during this time. So I don't have health insurance. I can't get tested for COVID-19. And I heard a conversation earlier that was had, but there are testing sites in New York City. New York City has a free cost. So individuals who do not have health insurance can get tested, as well as you can go on the New York City's Health and Hospital site. And right in the middle of the site, they show you testing sites in Manhattan, and all of the Health and Hospital, as well as the Gotham sites, along with the Dyckman Clinic on Nagel Avenue, are doing free testing. And individuals can get tested at any of these sites for no cost. So here's the other myth, is that individuals feel that they're undocumented, they can't get health insurance, but there are options for individuals who are undocumented. All children under the age of 19 years of age are eligible for health insurance through the Child Health Plus program, whether you're documented or not. So all children in New York City, there should be no one walking around. If you know of a neighbor or friends or anyone, they shouldn't be walking around without coverage, being concerned that they don't have money to pay for it. They have access to care. And then undocumented adults can apply for New York City Care, which is a new initiative that started last year. The mayor, de Blasio, made a big announcement in which it's not an insurance, it's not an insurance plan. What New York City Care is, it's an initiative in which individuals can get access to a facility and receive a doctor within one of the Health Plus hospital facilities and get a card that shows the name of the doctor and a payment that they would have based on their family size and their income. And they would utilize that location as their primary place to get medical attention. The New York City Care program is only approved right now in Staten Island, Brooklyn, and the Bronx, has not yet gone to Queens or Manhattan. There's an eligibility requirement where you have to reside in New York City for 6 months. Individuals who are in this plan, if they live in Manhattan, since it's not yet in Manhattan, they can select one of the facilities that are in these approved areas. However, they would have to go from Manhattan to Brooklyn and utilize the facility they selected in Brooklyn, but it's not in Manhattan yet. And on the bottom there, you'll see the nyccare.nyc as the location. They can also call 311, which is the New York City information line, and pick the prompt for health insurance, and they'll get a representative that assists them in terms of getting access to care as well.
Richard, let me stop you for a moment. So how does Health and Hospitals benefit from the NYC Care program? Does the city compensate you for people who enroll through NYC Care and then utilize services at one of your places?
No, so when you say COMPA, so again, we're a wholly owned subsidiary of Health and Hospital. So really, any dollars we get goes back to Health and Hospital. Health plan for Health and Hospital. So Health and Hospital mayor is just a big initiative, and most people felt like, how do you afford this? How would you pay for it? But the mayor took on this plight, knowing that New York stands for a very diverse population, and felt that through the marketplace, you had to be a citizenship or showed an immigration status, that you had a green card. And then when someone was undocumented, the system was being used regardless of documented or not. So they felt that they bypassed the insurance company and said, let's provide services directly through the facility. So the city picks up the tab.
That's right. So
The city picks up the tab.
Right. The city is providing the necessary funding to H&H.
Correct.
Okay, good. Okay.
So can I ask you a quick question? Does that mean that if one of your enrollees needs hospital care, that they are restricted to HHC hospitals? Or do you include, for example, New York Presbyterian hospitals in your
No, so the hospitals that are affiliated with us are NYU, Mount Sinai, St. Luke's, Roosevelt, and then the Health and Hospitals. We're not affiliated with Columbia Presbyterian. And that's been one of our challenges when we're in the Heights area, because in my past experience in pharmaceutical sales for 10, 11 years, Washington Heights was one of my territories. And I knew that I'm familiar with many of the physicians that are in the Heights. And, many of them have relationships with Columbia Presbyterian and still do. And so we're trying to formulate more relationship in the Heights area, because it is a very, Health and Hospital is very diverse. And also the people that work there in terms of potentially Metro Plus represent as well.
Okay, that would be a major, if you could establish a relationship there, that would be a great help to our community, because we are also dependent on New York Presbyterian hospitals.
Okay.
Right.
Okay. Well, the thing, and I'll be as transparent, of course, the biggest thing, and Metro Plus is trying to get there, but the biggest New York Presbyterian or the Columbia Presbyterians of the world is, negotiating a cost in terms of, hospital beds, et cetera. And so I have Manhattan as a territory, so I would love to immediately get them on as a provider. But what I like and what the executive staff would like are two different things. And so it always comes down to contracts and negotiating a certain price point, which without spending a medical loss ratio in terms of the dollars spent is something that the contracting team is concerned with. But I noted it on my sheet here.
Are there discussions going on now with New York Presbyterian? Is that it? Is this an ongoing discussion?
I don't, I'll have to check that, but as far as I know, it's not something that's going on right now.
Okay.
Because I'm always raising that question myself. I'm always, that's a concern. I'm always raising that question.
May I ask you a question or should we wait till the end?
Yeah, he only has a few more slides.
Okay.
All right.
Let's do this.
Yeah, I'm sorry, Richard, go back to your presentation, please.
Sure. So we offer free telehealth. So we know that everything is done virtually now. So individuals, we work with Verywell, excuse me, Amwell, and individuals can use the telehealth to get support. Some additional resources in terms of health insurance, they can contact Metro Plus. We have our virtual office. We work closely, reps have as a resource in terms of individuals getting SNAP through SNAP program. We work with HRA. There's also HRA mobile app that individuals can use in terms of immigration status. There's Action NYC that individuals can reach out to. Besides mental health support, besides Metro Plus, they can contact the mayor's wife has a initiative called Thrive NYC. There's a number there. Domestic violence, New York City's 24-hour domestic violence hotline. So there's a number there, as well as food or cash assistance, again, through HRA, their mobile app. And then they have English language centers where you get free weekly classes. They can go to the following link, which is nyc.gov /we speak NYC. I'd like to, get together with you guys and do some collaboration with regards to working with you in terms of working in the community. And besides this, I know that we're all doing things virtual. However, I've worked with Cloth, Community League of the Heights in the past. We're usually at a street fair with Cloth, but we don't do enough in the Heights, and I'd like to start formulating a relationship with the board and participate in events in the near future. My contact number is here. I can reach at this number, and the individuals shown here, this is my team. Nina Lemons is the Community Engagement Unit Manager. She's responsible for coordinating events. So usually in the summertime, we do events, and she's the coordinator. And then Hader Restituya is responsible for oversight of Metropolitan Hospital. Audrey Banana Williams is responsible for Harlem Hospital in Sydenham. And Rudy Lubin, whose picture is not shown here, has responsibility of Bellevue and Gouverneur facility. That's my presentation. I thank you for allowing me to.
Fern, is this a potential presentation for WICOA? Fern, are you still with us? Maybe not. Okay.
She's on mute. She's mute.
I am. I was just muted.
Who could ever mute you?
I only could mute myself. Trust me.
Oh, okay. All right. Okay. I didn't do it.
I actually wrote down some of your information, but not all of it. Could you go back to the contact slide, Richard?
Sure.
We are meeting virtually through Zoom. So I will talk to the executive board next week and see what their interest is in having a presentation from you.
I think it would be a good idea. All right, any questions from the committee members?
Yeah, I have some questions or some comments, okay? My reaction is that our community, as you know, is heavily invested in New York Presbyterian. And to my mind, if I'm someone who is on Medicare, let's say, basically what I'm seeing is that the closest major hospital that you offer is Harlem Hospital or Mount Sinai down on 98th Street. Is that correct?
Well,
St. Luke's
Mount
Roosevelt.
Sinai Morningside is on 112th, 114th.
Yeah, right by the cathedral.
St. Luke's
I call
Roosevelt.
St. Luke's. Okay, St. Luke's, right. Okay, St. Luke's at 118th Street. Okay. So
114th.
114th Street. 114th Street. Okay, so that's very much out of neighborhood. So if one has, for example, Medicare, it would seem in your own interest, I'm looking at different populations. If you have Medicare, it would seem to me that, gee, I just kind of want to run and stay with New York Presbyterian. Now, also, when you say you're trying to get contracts, I know a year ago, Empire Blue Cross Blue Shield had a devil of a time negotiating a contract with New York Presbyterian, and for a while I have Empire Blue Cross Blue Shield, and for a while was telling their members we may not be able to get a contract with New York Presbyterian. Not easy. So
Well,
just saying that.
Well,
No.
obviously, if Richard had his way, he would have a contract with the hospital.
Tomorrow.
It's in his advantage, to his advantage.
Yes.
And,
Okay, now
and,
the other thing I wanted to
we
say-
can't negotiate it for him.
No. Okay, now the other thing I wanted to say was it would seem to me many of City College students do not have health insurance and think they can't get it. And it would seem to me that this plan and what you offer would be extremely advantageous for those who have aged out of Child Health Plus and are not yet eligible, not yet have any kind of employer plan or something. And it would seem to me to really target the thousands of students we have in our community who are have aged out of Child Health Plus. And I wondered if you have made any outreaches to the thousands of students in our community that attend Lehman College and City College and Hunter to try to offer this to them.
So we, prior to going remote, we were at City College twice a week and had a presence at the facility. We currently have the marketing representatives' information on their website so that students can contact. We have a good relationship with the health services nurse there with City College. We also have a relationship with Hunter College as well. So we always try to engage the students and make sure that they know that they have access to care. Besides us, there's other health plans there as well. So it's a constant, we rotate days to make sure that students realize or are aware that they have access to coverage. And then we also think of ways where we can currently engage students through Zumba, because you have to figure out a way that you get access to the students. So we work with the schools to try to put on some type of activity so that it then gets students involved. You mentioned that, you mentioned something about Medicare. We also have a Medicare product as well. And we offer activities because of the COVID, most individuals who are 65 plus may stay indoors and then maybe not as active. And so we try to work with the communities to offer activities for seniors to get involved, where it's a Zumba, Zumba over the virtual and get them moving and going. And where prior to that, maybe there's a snippet of a presentation, but the main thing is to present and then provide an activity as well. So we offer a variety of ways to try to get people engaged while they're remote.
Well, that would be a good item to talk to the Ferns group, the Washington Heights Inwood Council on Aging. I want you to explain to them how you get the seniors to enroll while they're practicing Zumba. Any other questions?
I have a question.
Who is that? Sally?
Yes.
Yeah, and then I have one after her.
Okay.
Yeah, for
I'll hold it
Medicare.
one second before anybody says anything. I think I really goofed. But Paola, did you get a text from Natalie that Natalie wanted to be put on as a panelist?
I did that almost at the beginning of the meeting when she joined us. I don't know if
Oh.
she's still here, but she's a panelist already.
Yeah.
So Natalie, what
There
did you,
she
what
is.
okay. Did you ask me for something before?
No, that was it, Steve.
Oh, okay. All right. So
I
we,
think it's because you have it still on shared screen that you're not able to see everybody that's on the call with you.
no, how
So
do I do it?
if the presentation is over, Mr. Taylor can close the screen now.
Okay.
Okay, sorry about
Richard, could you send me the presentation so I could distribute it to the committee members and be able to refer to it when I'm doing the minutes?
Sure.
All right. So, but Paola, how do I get to see who's participating?
Right now, as soon as he gets
Okay.
off, I'll be able to see because I have restrictions too.
Oh, you have
Oh.
restrictions?
Meaning that I don't have the same view that I have. I only see his computer now. When that is
You
gone, I
understand?
can
All right, so let me figure out how
get
to.
into the system.
Okay.
Wow, even the Wizard of Oz has restrictions.
Yeah, no, because when you share a screen, is the person that has
Yeah,
the
yeah.
screen that has control of the screen. So until he
Okay.
closes that screen, I can still control the
Okay.
streaming, but not the screen.
All right, I'm just
I
trying
don't
to.
have that much magic.
I see. Here he goes. How do I exit screen?
You should see a button that says like stop share screen.
Oh, stop.
Maybe at the top middle.
Stop. There we go.
Ah,
You're
Okay.
back.
Well, now
See? There you go.
I have a nice shot of Barbara lying down.
Correct.
How do
At
we?
least I'm not in my pajamas, okay?
And you do
I don't
have
want
Sarah with a question.
mute
Her,
my phone.
her hand is
Hey,
raised.
Barbara, I don't want to hear about it. But is there a way in which I could? Oh, what is this thing here? What is it? Oh.
So it's Sally, then Daryl, then I don't know who else has questions.
I have a question too.
All right, go ahead, Sally.
Okay, for Medicare beneficiaries that want to retain regular Medicare, which does not restrict your options of providers, but might be interested in a Part D product, do you offer that for
No,
prescription drug
so-
coverage?
No, we don't. So our plan is an Advantage plan where individuals join and then they have Metro Plus as their plan. And the plan includes, but you restrict it to Metro Plus, but the plan does of course include pharmacy benefits.
Right, but you can't
it's not a
enroll,
supplement, it's
you
not
can't enroll just for Part D.
correct.
Okay,
All right, Daryl, you next?
Yeah. You can hear me okay?
I can hear
Yes.
you.
Okay, great. I'm sorry if I missed this. Did you say what your enrollment period was?
The enrollment period ends June 15th.
So have you done any outreach, especially to those? There are so many folks that are unemployed newly. Is there any special outreach you've done to those folks?
I'm trying everything. So I reach out to any organization. So anyone we tried to work with the Department of Labor and I got in contact with the regional office and that fell through. Currently the representatives, we also work with the mayor's office and the CEU unit, community engagement unit to sign up individuals. But our staff, we try to get as many leads as possible and contact organizations that provide us access. We also do advertising, so you can, you'll see Metro Plus in media ads. And we recently did something with one of the radio stations where we did a telethon and encourage individuals to contact us so we can enroll them, similar to back in the day, the Jerry Lewis telethon. Where we tried to get individuals to contact us to enroll. So if you know of, that's hopefully one of the reasons I'd like to present is that if you know of organizations or any way you can connect me and my team to any organizations or anyone that works with a group of individuals and give us lead, I'm more than happy to assist in getting those individuals enrolled. Because as we've been working remotely, we've been keeping a good pace, and an initial week, a month or month and a half, we were inundated with individuals looking to get health insurance because of the fear that they were not covered, and also that individuals had lost their their livelihood in terms of their employment. And so they did reach out to us, some just through friends, some through word of mouth. And the more we got the opportunity to speak, the more people said, oh, call this person, call that person. But there's no straight organization.
All right. Anyone else?
Yeah, maybe reach out to the Washington Heights Business Improvement District, the Washington Heights Chamber of Commerce and Women's Chamber of Commerce, and they can get that information to their businesses who can get that information to their employees or ex-employees.
Okay.
I wanted to ask, under your Medicare plan, do you have silver sneakers?
We do.
Hold it a second. Hold it a second. What is that?
Oh, it's great. He'll explain it.
It's more of a, we just recently, it's more of a health, kind of a fitness reimbursement for seniors.
Oh, okay.
We increased, we were always competitive, and we have a OTC, over the counter card as well, where individuals get a certain allowance to spend quarterly on over the counter prescription. The silver sneakers isn't, they don't believe it's called silver sneakers, but we do have a plan for seniors in terms of fitness.
Okay, very good.
What you get to do with silver sneakers is you get to use pretty much any of the health clubs for free.
Except not now.
Okay. Okay.
Exactly, right, Sally. Correct.
Okay, Fern, you have a question?
Yes. Do you have any estimate, or is there any corporate projection of when NYC Cares will be coming to Manhattan? Because I would say that the real target population among seniors is a very large group of seniors who don't have health coverage.
You mean undocumented?
Documented?
Yes, undocumented.
Yes.
Undocumented. Okay. According to the New York NYC Care website, it was coming to all the boroughs in 2020. But I think as a result of this pandemic, I couldn't tell you a time frame. But that's what's on this website.
Do you know what the old time frame was, or it's just sometime this year?
No, it was never. I never had a time frame. It was,
Okay.
the time frame was always like sometime this year. They never said, it's coming in Q2, or it was like 2020. It was never a time frame for a minute.
And who is DOH administering it? Who's administering New York City Cares?
The mayor of New York has appointed. I can't think of the. He took the woman from. She was heading some big organization. I can't think of her name right now.
All right.
I'm not sure what department, but it was a huge announcement. And
all right. Yeah. All right. Well, if you get me, I'll look for it on the web. But if you could also furnish me with that information, Fern, that's a good issue for us to follow up on.
Steve, I have one more question.
Who's that? 1 second, Barbara. Hold off. Anyone else? All right, it's back to you, Barbara.
My question is this: since Fern identifies that many of the undocumented will be in the senior population, which requires much more health care, is my impression was that New York Cares was basically only going to cover kind of a wellness aspect. In other words, like a physical or immunizations or that kind of thing. And it was not going to be a comprehensive health plan. Would you correct me or explain how comprehensive of care would New York Cares give?
My understanding of New York Care is that it's the place where you go to one stop to get all of your care. My understanding that it is comprehensive. So again, they've cut out the middle person, but you're getting all your care. They'll let you know how much everything, the card, my understanding is the card will display every cost that you're responsible for, whether it's pharmacy, hospitalization, the gamut. It's explained on your card so that you know what the cost is. And
cost be for pancreatic cancer? An undocumented senior comes in with some stomach pains and they say, oh, it's pancreatic cancer.
Well, I wouldn't know what the cost would be for pancreatic cancer. So I couldn't answer that question.
Oh,
I can,
But I can.
hospitalization. Would the
I can,
hospitalization rate?
I can also add that besides, the Health and Hospital also offers a program called Options as well, which is a sliding fee scale that's at the facility, in which based on your income, they give you coverage as well, and you get access to care. And it's called Health and Hospital Options, and it's a sliding scale, and you get coverage. Surgery, hospitalization, pharmaceutical drugs. So if you're making a certain income, it's a pretty good option. I ran into, without saying, I ran into my tailor in there one day, and I know he does pretty well financially, and I was looking to have him enroll into Metro Plus plan through the marketplace, which you have to reveal your income. So when you go through the marketplace, it's run through the state. So they ask you did you file taxes? And if you say yes, they identify you and they know what you filed. And so if you said you made 40,000 and it pings anywhere 10% or 10% above and below, you'll go through. But if it's a 20% difference, they'll ask you for verification of your income. And I asked him, hey, why don't you join? And he said, no, I'm sticking with the options, because the options, whatever income he told them he had based on the fact that he was tailoring, he was getting great access to care for a lesser price. Because if he went through the marketplace, more than likely, if he gave his true income and he filed taxes, he would have to pay for maybe $1,500 a month for his family, or $700, whatever the cost would be. So he took the options route.
Who was this?
Richard Taylor has a tailor.
Yeah, I had a tailor. It was my tailor.
Your tailor. Oh, I
My
see.
tailor. It wasn't Richard Taylor, but a tailor.
Richard,
Richard Taylor's tailor.
hopefully spelled differently. Okay, any other questions? All right, Richard, hopefully this is the start of a beautiful newfound relationship between you and the community board.
I hope
Thank
so.
you.
Thank you for the time.
Okay, please remember to send me the PowerPoint.
You got it.
All right, thank you so much.
Thank
Julio Batista, are you next? Yeah, I'm sorry, you are next.
Okay, hi, Steve.
Okay.
Thank you, everyone, for having me. Just want to cover a few things. I'd just like to recover the fact that our CHARC program, who some of you are very familiar with, I know Sarah has worked with CHARC in the past, continues to work around the issue of food insecurity in our community. It's an issue that has continues to grow. I know that NIMIC, for example, which didn't have a food pantry, does now have a food pantry. So the issue of food insecurity is something that is increasing in our community. And so does CHARC's effort to help in addressing that issue. More than happy to have them come before the board, before this committee, to be able to provide additional details on how they're actually doing that. So, again, kudos to the CHARC program. I also would like to present that we also have two initiatives that are taking place. Bringing this before the committee to get your feedback and perhaps get some indication of how best to do this. So one of them is really, we talked about social distancing, how important it is to raise awareness. So one of the things the hospital has done is created social distancing floor decals, which we are providing for basic local community-based organizations. I'd like to thank Sandra Harris, Isidro from the bid, and also Yvonne Stennett, who have taken some and are helping to distribute. But we do have, we want to show that everyone in the community, only businesses or CBOs that need them will get them. So, please think about it. Let me know any business that you think could use them. We'll be happy to be able to distribute those. We want to target as many community merchants and businesses as there are. So feel free to please send me those information. The other one is, I guess a couple of months ago, the New York State was about to initiate the 5 cents per bag fee. This is a bag that, encouraging people to reuse their bags. And I believe there was a 5 cent surcharge that was going to be implemented. Because of COVID, that was put on hold. However, it looks like some merchants have on their own, I guess, started charging, patrons or customers the 5 cents fee. I don't know, why, but so we've taken on the task of ordering some reusable bags. We have distributed those through Chalk for their distribution. We have given some to other not-for-profits like Nido and Chalk and Cloth. And so we have additional bags. And again, we'd like to hear from the committee for any ideas or suggestion how we can distribute those bags to people that need it. Because, for some of us, 5 cents may not be much, but for a struggling family, 5 cents every time for every bag adds up, and it could make a difference. So I think it's important for us to support the community. And so we want to be able to make sure that we get these bags to where they need to go. And again, look forward to hearing from the committee members and how to do that best. One of the other things I just would like to also say is that, we talked about social distancing and promoting the safety of our patients, visitors, and staff. So if you go to the hospital, starting basically tomorrow, you'll notice that there will be separate entrances now. We have separate entrances for employees and have separate entrances for staff and patients. That way, people do not congregate, we could provide that opportunity for social distancing. So we're rolling that out at the hospital, creating those different entrances. So that is really, what I want to report on tonight.
Do you have any specifics on the COVID-19 situation and how the hospital is dealing with the patients and?
Well, the only thing I can say, Steve, is as the governor, the mayor have reported in the past, the numbers continue to decline. We are seeing less patients. We have less patients at the hospital. We still have some very sick patients, unfortunately, still at the hospital. But the number of patients have dramatically decreased. And I think we're in line for that sort of, next phase of as the governor had mentioned. So I think the numbers are on the right track.
I mean, has the hospital started returning to normal? I mean, there was a point at which I think operating rooms were being converted into ICUs. Is that still the case?
Well, we need to get some guidance from the governor in terms of when we could start doing certain things. I mean, emergency procedures are being done. In terms of elective surgery and those type of items, that we need to wait for the governor to let us know when we could do that. In terms of modifications, for example, I know that we've talked in the past about the Larkin Field Hospital, for example, Bakerfield. Those installations will remain. We just don't know what the fall and winter brings. So I think in abundance of cautions and to be prepared, some installations will remain in place.
And at this point, would you have any numbers on how many people have been treated at 168th Street and at Allen?
I don't have the number for just for this particular campus, but I can say that in terms of hospital-wide, it has been over 10,000 patients. To be example, it's 10,350.
Would that include, is that just within New York City, or that you have hospitals outside the city limits, right?
That's the New York Presbyterian system.
So that's outside, includes outside the city. So the number is 10,350?
Correct.
Those are the number of patients actually treated.
Right, and right. Mhm.
And 10,350. And of that number, do you know how many were discharged?
Well, Steve, my correction. The 10,350 were discharged patients. Right. I don't have a number, an overall number of total patients, but I could certainly try to get that for the committee.
Yeah, we'd appreciate it because we have been trying to get that number for quite a while.
Well, I think when we were last time, Anna did report, did provide overall numbers for the system.
No, but never really provided a total of how many have been treated, and specifically at the two locations in Washington Heights and Inwood. So that's been a disappointment. But I'm wondering to the extent that that Presbyterian has had to handle the load for the city as a whole, because if the hospitalizations in New York City have been 52,528, and maybe you've handled about 20% of that. I mean, if the 10,000, but the 10,000 go beyond the city limits. But I got Barbara, please. I gotta believe though that probably a large majority of those 10,000 discharges, or we don't know the total number of hospitalizations, but it seems to me it's possible that New York Presbyterian has handled maybe 20% of the citywide load in this case. I would love to know that number. I would think that you guys would want to have that number.
Sure. I'll see what numbers in terms of.
I'm sure you
overall.
guys have the number. All right. Any questions? Sally.
Yeah, just a couple things. First of all, just to confirm, I love CHOC, and I think it would be great if we had a presentation, because they're not only doing things to better the health of our community, but they're also providing education, other resources to community-based organizations. So I think that would be extremely helpful. Second, just a shout out to your hospital staff, both the providers and anyone who's working in the different units. I've been getting great reviews from people I know who are in the hospital for non-COVID related surgeries. And finally, I just had a question about your social distancing signs. Are they weatherproof? So they could be put, on sidewalks in parks, installed in sidewalks in parks and on our streets, on our city sidewalks.
That's a good question, Sarah, because there are some sort of, they're laminated.
Right.
And they stick to the ground, but I'm not sure how well they would stick to concrete surface in the sidewalk.
Okay.
Yeah, a lot of our stores could use that. A lot of our stores have got people standing on line outside. It would be good to know whether or not they would adhere to concrete.
Mm-hmm.
A lot of people just use electrical tape.
Yeah.
Yeah, but that could easily come off. Well, okay.
Even in our parks, Steve, because we have we have a few of those signs up, but where people enter the park or where they congregate, just to be able to build a circle. I mean, we're trying to do it with chalk. I mean, chalk being the chalk that you use, not the chalk at New York Presbyterian. But it would be nice to be able to have people see those more often.
Yeah.
All right.
Yeah, I could certainly get some over to you, Sarah, or to Steve, so you can look at it.
That would be great.
Can you just email something to me so I can show it to people?
Sure, I'll do that. Actually,
Okay.
if you get the emails from the Washington Heights Chamber of Commerce, this morning they sent out a notice that has a rendering of the signs.
Okay,
They're both in English and Spanish.
okay, let me look for that.
And also, if you want people to distribute bags, Friends of Wood Hill Park is happy to help out.
Okay.
Oh, yeah, she's good on bags. Any other questions? Okay, very good. Okay, thank you, Julio.
Sure.
Julio already has his air conditioner. See that?
Yeah, right behind.
Yeah, right. Very good. Janelle, are you filling in for Sandra?
Hi,
Janelle,
Steve. Yes, I am. Sorry, I was on mute. So I had to turn my mic back on. But yes, I'm filling in for Sandra tonight.
okay, very good. It's your turn.
Okay. So I'll be very brief in terms of the updates. Columbia University President Bollinger responded to the current protests of racial injustice in a statement throughout the university.
One second, Janelle, before you go any further.
Yes.
Are you gonna send me something so I don't have to take too many notes?
Oh yeah, I will definitely send it to you tomorrow.
Okay, very good.
Mhm,
Okay, that's okay.
yes.
All right, continue with the report.
Sure, not a problem. And just I included one quote to highlight just so you have an idea of the tone of his message. The horrifying ending of the life of George Floyd, a citizen in the very system of justice intended to protect him and us, which then, along with other recent tragic deaths, drew back the curtains on centuries of invidious discrimination against African Americans and others. Dean Goldman also released a similar statement throughout the medical center, where he endorsed the recommendations shared by the Association of American Medical Colleges. And one of the recommendations that they included was an acknowledgement and speaking out against all forms of racism, discrimination, and bias in our environments, in our institutions, communities, and society. On this past Tuesday, we had a COVID-19 research forum, which was done entirely online, as that is now the new normal. So we apologize for not providing any of you with cookies and pinwheel sandwiches as per usual. But we partnered obviously with CV12, the Health and Environmental Committee, the Department of Emergency Medicine, the Division of Infectious Diseases, Northern Manhattan Center for Excellence in Minority Health and Health Disparities, and the Irving Institute for Clinical and Translational Research to offer efforts on treating and combating COVID-19. That entire seminar will be available on Columbia University's YouTube channel. The links will be included in the report that I'm sending to Steve later. This event will be offered to the Spanish-speaking community tomorrow, June 5th at 6 p.m. via Zoom webinar. And the attendees obviously are required to register because it's being done on Zoom. This will be done entirely in Spanish for that community. The Fort Washington Green Market will be returning on June 9th. As you know, the market is located on 116th Street in Fort Washington. We've been working diligently with the organizers to make sure that social distancing will be maintained. The list of vendors are ones that you're familiar with because they've been there before, so you can look forward to seeing that happen. Please note, there will be no scrap or clothing collection on site until further notice. And the final update has to do with the opening of the dental clinics. Over the next few months, they will be slowly reopening. We have remained open throughout the pandemic for emergency care, but the regular services will be available for preventative and routine care slowly within the upcoming weeks. So you can just look out for those updates from us. And that's it. Does anyone have any questions?
All right, so you're also going to send me the presentations from Tuesday night. So some of them I thought were very interesting, and I'd like to circulate them to the committee members.
Yes, definitely.
Yeah, I was there. It was great. Really
to
good
hear
job. Yeah, no, I loved it.
Okay. Anyone else with a question or comment? Oh, fantastic. All right, very
right.
good. Thank you. Thank you,
Have a
Janelle.
good night, everyone. Oh,
Hey,
yeah.
can I ask you a quick question? At your,
Sure.
at your market, did you, do compost collection, and will you be doing it again?
No, I
Okay.
think that the collection has been suspended throughout the
Right.
city, actually.
Right.
Yeah. Yeah.
Yeah, we're doing it at the Ring Garden, but we're hoping that other locations will open.
Yeah. All
Steve
right.
Julio has his hand up. Steve Julio wants to ask a question.
Julio has a question.
No,
Yes.
I'm sorry. I
Oh.
just wanted to add something with regard to the hospital. We've done a lot of, to try to avoid patients to come into the hospital. We've done a lot more telemedicine than televisits. And so I just want to offer to the committee, Dr. Mara Mingus, who some of you have met, has done a really nice, very short, like 3-minute video about accessing and learning a little bit about telemedicine, and be happy to show that to the committee next time. If you want, I could send it to Steve ahead of time so you could take a look at it and see if it's appropriate for this committee to view at their next meeting.
Is it PG? I can only
No,
show it if it's PG rated.
No, it's G rated. It's G.
Well,
And you know we're gonna ask for those numbers too, though.
yeah.
She's presenting at Waikoa this month on Zoom, Julio.
Yeah, I know.
Okay. Okay, if she can do it to Waikoa, she can do it for us. Okay, so maybe we'll.
I'll shoot you the email, Steve, so you can look at it.
Okay, very good. Okay, well, you're gonna give away the plot ahead of time. Okay. Where were we? Any questions for any other questions for Janelle, or did we finish with her? Okay.
All right. Thank you, everyone. Have a good night.
Okay, remember to send me all that stuff. Thank you, Janelle.
Will do. Will do.
Okay, and did Betty Lehman ever join us? Betty? Okay, so she had a family emergency, but she, in her absence, I guess asked me to read this into the record. I forwarded this statement to the committee members, but there are various other people on the call who would not have received it. So let me just read this statement on behalf of the Isabella Geriatric Center, which also goes under the name of the Isabella Center for Rehabilitation and Nursing Care. Isabella Center for Rehabilitation and Nursing Care remains committed to providing compassionate quality care throughout this pandemic, just as we have for the past 145 years. We stand with our grieving communities and staff and share our deepest condolences with the families who have lost loved ones. We also thank our heroic staff who have bravely remained on the front lines to help protect the most vulnerable in our society. With respect to an update, we'd like to share the following. All residents of Isabella were tested for the COVID-19 virus. Going forward, they will continue to be tested as appropriate. Isabella employees are being tested consistent with the governor's executive order. Isabella has secured PPE to protect our staff and residents. Like every other health organization in March, we were concerned about having enough PPE for our employees, which is why we repeatedly appealed to and worked with city, state, and federal officials, private resources, and vendors to secure and purchase as much PPE as possible. Although we faced initial challenges with securing enough PPE, for example, Isabella spared no expense or effort to ensure our staff had and continues to have the PPE they need. At no time has our staff been unprotected. From the beginning of this pandemic, Isabella has reported complete and accurate data to the Health Department, State Department of Health, I assume, sharing daily the number of confirmed and presumed positive cases at the nursing home, including deaths. For the latest information on COVID-related cases and deaths, we suggest you visit the State Department of Health website. Since March 12th, CMS, that's the federal agency, Center for Medicaid and Medicare Services, and Department of Health, have required all nursing homes in New York City to close their doors to visitors. We realize this has taken an emotional toll on residents and their loved ones, and have taken a number of actions to support families during this health crisis and increase our communication efforts, including 1, A hotline has been set up so that families can call and check on how their loved one is doing. Our nurses on the floors are happy to speak with families, but are often in residents' rooms providing care and are not able to answer the phone. So we have added a hotline that will be available 7 days a week from 9 a.m. to 5 p.m. This phone line will be answered by a bilingual member of the Isabella team. If they cannot answer a question, someone who can will call back that day. For HIPAA privacy reasons, only individuals authorized in the resident's medical record may be given information. Two, video calls with residents continue to be available, and families can contact us directly to schedule video call appointments. Three, the daily update line provides information about COVID-19 related activity at Isabella the prior day. Based on new CMS guidelines, the outbound recording is updated by 5 p.m. each day. In May, the Department of Health conducted a 2-week-long comprehensive survey of Isabella. They found there were no major violations in our infection prevention and control procedures, a testament to the round-the-clock efforts of our dedicated staff, and there were no inaccuracies in our COVID-related reporting, a finding that discredits previous allegations by some media and elected officials. The COVID-19 pandemic has required nursing homes to implement heightened infection control policies, and these findings demonstrate our efforts to ensure we have done this to the best of our abilities. Isabella is committed to providing quality care and continuing to fight this virus tirelessly. This includes doing the best we can to help protect our residents and staff, as well as keeping families informed and engaged with their loved one. Thank you. So that is the statement from Isabella. And hopefully Betty will be able to join us at the next meeting.
Maria has a question.
Well, I don't know that anyone can answer it. Maria?
Of course you can. Anyway, I've been listening from the presentation from the Metro and everything. But this morning we had a meeting with the aging committee, and one of the issues was about Isabella, that Mary Anderson requested that anybody that will have magazines, nice magazine, either in Spanish or English, to be donated for the residents of the Isabella. They still are not receiving visits from the relatives. So this will be something in addition to just the phone calls. So anybody that have very nice in good condition magazines and books, that they can be donated to Isabella residents.
Okay, well, you have what, you still have a 10-year supply of Hola magazine?
I have 20 years supplies of National Geographic, and also the Natural History magazine from the Museum of Natural History.
Oh yeah, my God, yeah, yeah. But what's that other magazine? Damn it!
I'm not gonna tell you.
Okay, yeah, it's not definitely not PG rated. Okay. Any other questions or comments? All right, very good. Under old business, I sent everyone the DEP report for May. There were 316 service requests generated from our district. The most frequent one was noise from ice cream trucks. 64 complaints, 44 complaints on dirty water, 38 complaints about noise from alarms, and 31 complaints about hydrants, running hydrants.
Steve?
Tanya.
Are you getting the reports for I know you're getting the DEP stuff, but are you getting the reports from the NYPD about noise that has to do with like partying and music and that type of stuff?
Nope.
That kind of quality of life. Because remember we talked about that before. Remember we were saying that maybe we would start, including that in the reports, because I think that's a big part of the problem, like in terms of our environmental, just quality of life, that kind of thing, because there's a lot of that kind of noise going on, which I know Sally can attest to and others can attest to. I know where I live, it's like party central. So I'm just saying it's ridiculous. It's unlivable, especially in the summertime. It is absolutely unlivable on this side of Broadway during the summer. I have had to go to hotels sometimes just to get some sleep over the week, over the weekend.
Wow.
It's and sometimes during the week. It's absolutely ridiculous.
Well,
Um,
is there anyone here who's on the Public Safety Committee? I don't know whether the police department generates specific reports on noise complaints.
They do, but 311. It's 311 complaints.
Yeah, and
May I speak?
do they separate them out into
May I-
categories?
may I speak?
Yes, you.
All right, so let's
See,
ask for it.
And I was actually wondering too,
Well,
do we get a report of what time these complaints come in? Because I'm curious now with people at home more than ever before. They're not just complaints at night anymore, maybe.
Yeah.
You know,
well, these are definitely these definitely include complaints during the daytime.
yeah, but they,
Steve, let
And,
me
and
know.
the nighttime complaints may
They
actually
don't-
be the ones that go to the PD. Natalie, did you have a question?
That
Natalie?
was Sally.
No,
That was
I
Sally.
just, I,
No,
I, I did
I
just want to point
the
out that,
problem is,
oh, okay. Sally, go ahead.
no, after you.
Okay, I just did want to point out as far as getting the data on the noise, that 311 complaints, Beta NYC incubated out of our office can get those for you. And you can have them broken down by a lot of different reporting indices. So if it's by block, time of day, type of noise. What I would say is that then when a noise complaint generates a DEP inspection, very often the threshold of what qualifies as noise pollution to DEP is very, very different from what a quality of life level complaint is. And I have actually been part of conversations in which there's construction noise. The construction vibrations are such that they cause cracks in plaster in people's apartments, and yet that still did not meet the DEP threshold for being an excessive decibel violation. So that's something that I think maybe health and public safety could maybe talk about together, and get some real sense of, maybe at the district services cabinet, get a better sense of how these agencies are measuring what is essentially the same complaint.
Yeah, well, the numbers that I read off on the from the DEP report are purely complaints. They don't reflect violations. Those are just complaints that they've received. So we don't really know, and they don't unfortunately then give us a more detailed report indicating
Steve, let me clarify.
the number of violations issued pursuant to those complaints. They only compile them twice a year as part of the mayor's manager report.
Steve,
but-
I can
but
clarify
Natalie,
something there.
1 second, please. But Natalie, I would like to talk to you further on how we can get the noise, a more fully rounded report on the noise complaints as you just described.
Okay, well, I'll email you and we'll connect you with our data people.
Yeah, please. Okay, Barbara.
Yeah, every morning, the 34th precinct, the NCOs in
What?
receive a print.
What's that? Barbara, start again. I lost you.
All right, every morning, the NCOs in the 34th precinct, and actually in every precinct, receive a printout from 1PP of the 311 complaints. And they actually are mapped by location, which then gives the NCOs an ability to look at where the problem spots are. They also are able to identify if it's merely one person who's called up 50 times. In other words, which they can sort of think, is this one dingbat who's just, has a grudge against their neighbor or the kid on the street, or that it's like 10, 15 people who are calling up about a problem, okay? That's also the importance that people not report these things anonymously, because then when they see that Barbara called and Steve called and Sally called, and we all live around in the same building or next door to each other, it gives a very high credibility to the complaint. Like Tanya, what you are suffering under, what you should do is organize about 10 of your neighbors to absolutely, when this starts up, to hit the 311 app. It really helps. I mean, I can tell you there's certain little clusters about where I live in the hillside, Elwood, Nagel, which absolutely, we had a pacification program and it really works. So I'm just saying, but you have to get people who agree with you, and we'll hit the app and call this stuff in when it starts up. But every day this is analyzed from 1 pp. So I'm just, telling you that.
I agree with Barbara. I just wanted to say, yeah, I agree that that's an effective strategy to try to get people. I totally with that. But what would happen is people are afraid to go on record about complaining about their neighbors, and we've run into that problem around. I'm in the 33rd, so we've run into people afraid. Like, honestly afraid. Like, I've literally made the cops come to the particular building, one of the buildings where they have literally was having like nightclub like parties where it's shaking our wall, my wall over here, and I'm a block away. And had the cops come, had the NCO, had people come. And it's like, and the superintendent of the building is like, yes, it is this apartment. I can't get any sleep. But then when you try to get the cooperation with the superintendent for an investigation, he doesn't want to talk. So I don't know. That's a problem. Like, people are scared of people around here because you never know. Like, honestly, you don't know what people will do, and so I think people are afraid. I always put my name on it. So I'm just going to say, and I put my name on it, but I hear Barbara and I'm like, well, how can we overcome that obstacle to organize people,
Yeah, I understand. I mean, we had a Elwood and Hillside by the school, a street party that would start up. And as soon as it would start, we would get the calls out. I mean, people were trained that if it's bothering you, you've got to call. And we'd get between 5 and 8 people who were agreed to do this if they were aggrieved. It wasn't harassment. It was, like you said, are your walls shaking, or you can't sit at your table and read a book, and they would. And the NCOs really got on it. And these guys were slick. The NCOs had to literally go up there secretly on foot, because if a car approached, they knew how to turn down the volume. I mean,
absolutely, yes, that's it.
A Mutt Jeff act, a real Mutt and Jeff, Tom and Jerry act for them. Now, also the 34th, I don't know if the 33rd has this. The 34th has has 3 or 4 decibel meters. And in other words, on your iPhones, you can actually have these noise meters, but they don't count. They can't be used in a court of law because it goes through a third device and it's not considered legal. But the 34th has these decibel meters, and those are court accepted evidence. And they take, for example, at some of this Dyckman Strip and such, they would take decibel readings and then issue big tickets. And that also really calmed things down. Now, I would say for your problem with this nightclub operating in an apartment, the 33rd should be on that with the decibel meters, because then they've really got to open up the door. They got to pay the fine. They know where it's coming from. And that, I would say, would be the next step, demanding that of the 33rd. I mean, that's, I mean, that would be the next step. And it's these handheld devices that are legal in court. And again, you can then, taking it to the next step, if they have this continually and the landlord has not dealt with that, that's a reason to go after the landlord and not pay rent. So that's enough. If you're not in that building, it's the
You got to get the tenants who were in that building. That's good advice, but Tanya,
it's a problem. It's a problem, Steve.
But Tanya's got a much more difficult organizing situation than you have. You have the benefit of being in that Mitchell Lama building, and you got people who are
yes.
And also, Tanya, I've been on the street I've been on the street for over 35 years. So, I mean, I know people where they go,
Barbara,
oh,
Barbara, please watch your language.
what? What do you mean? So I know people who say, oh, I
People
remember
on Facebook are watching.
you had that long hair, you know?
Right,
So
yeah.
it's also, there's a certain amount of, you know, so that helps. It's not just my building, it's I've been on Hillside Avenue since I was in my 20s. And so other people know me.
All
and
right, well, that's only a few years ago. Okay, but that was good information you just gave us. Thank you.
Yeah, so Tanya, let's work together on that so that you have a
but
good
Yeah.
summer.
But could you find, but since you're an officer of the precinct council, could you find out whether the 34th precinct could easily compile for us a printout showing where the noise complaints are generated?
I think, I know that since that printout comes from 1PP, that's probably confidential information. And I'm not even sure if I was supposed to tell that.
Steve,
will-
Natalie, what Natalie said was true. The Beta NYC thing, that's what I told you about before. That's where I got my info, and I pulled all info, and I went down to the precinct at 33rd, showed the lieutenant and said, do you see this building with hundreds of noise complaints with loud party that happened over this small period of time? So Natalie was right. Like, that is a tool we can use. You can pull that yourself. And if you want, Steve, I can show you how to do that. I can show you.
And
You and I
familiar
can.
with that.
All right, you're probably, either you or Natalie will probably have to show it to me.
Yeah. Oh, yeah. Natalie can help you too. Obviously, she's an expert because that was an initiative that came out of their office. So.
All right, very good.
To be clear, like Tanya says, this is all open access information that you can link through Gail's page. But if you wanted to do a report request, I can kind of walk you through some of, with some of the experts there, how to do that.
Yeah, please walk me through it. Okay.
The bottom line, this is neglect by the 33rd to let this kind of situation go on.
Yeah.
Real
I
neglect.
agree.
Okay, well, I don't think Tanya will disagree with you. Okay. Okay, I also sent everybody, we're still under old business.
Maria Luna had her hand up.
One comment. So did I.
Maria Luna, go ahead.
Okay, I've been listening to this. I know that Tanya has been very vocal about the issue, and it reaches now a mental situation. It's really a problem that is happening not only where she lives, in other areas. The police is doing a study. The 3-3 is doing a study about the areas in our areas where and how to attack that particular situation. Landlords have to be, cooperating. Some of the landlords are not cooperating. Also, we have the NCOs working very hard on that. One of the problems is that once the police goes to a certain situation, the music and the noise disappears, and until they can grab those people who are making the noise, they cannot enforce anything. So the minute that they disappear, the music goes back on. I'm sorry, Tanya, that you have to spend money going to hotels. I mean, that's really very serious. I'm going to try to look into that to see how we can remedy that situation.
Okay, very good. Thank you, Maria.
Thank you, Maria.
Barbara, you still have your hand up?
No, I'll take it down. Sorry.
Yeah, take that hand down. Okay, anyone else?
Yeah, I get a weekly listing of 311 service requests. I don't know which is from CityGram. So in the last week, for example, there were 1,348 CityGrams for service requests. And they range from people not social distancing to noise complaints. The problem is, and I don't know, if this is an issue with the database that you were talking about, Natalie, they're not recording or sending any requests that happen after 10 o'clock at night. So I guess I should, contact or find out what you guys have. And then the problem that we're facing actually with noise, at least in my neighborhood, is complaints are filed and then they're closed out, no issue found. Almost as soon as it's like someone's sitting at the precinct, and the minute it comes in, it doesn't seem like there's time to check it out.
Yes, Sally. Yes, I agree.
That they're closed out almost immediately.
Well, that's the catch-22. Even if they send somebody out, by the time they send someone out, could be the next day, and you no longer have a noise problem.
No, 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 no.
I don't think it's that. I
It's
think that they're closed out before they're looked at.
Yeah, 20 minutes later, they say, went by, saw nothing. No, 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 no.
Right, right. Okay, so the next, I also sent out to you the monthly DDC report about construction projects underway in our district. Looks like they've made significant progress up in Inwood on the sewer and water main project. Last month they were at 65%. Now they're up to 90% completion. And the project, the water main project, east of Broadway in the 160s, is now at 99%. Actually, that's where it was last month as well. And there's a water main project in the 180s between Broadway and St. Nicholas, and that one is still at about 20%. Has not really moved very much over the last month. One of the 4 projects, as I mentioned last month, has now been completed, which is the water main project around the medical center from 165th to 172nd Street between Fort Washington and Haven. If Mary Anderson is still on the call, it's around where Mary Anderson lives. That project, according to DDC, as of a month ago, was 100% completed. That's it for old business. Is there any new business?
Yes. This new business.
Is that Sally?
Yes.
Okay,
So
go
I've
ahead.
been, okay, so as I've been trying for, I guess, since last year to get the district, our community board office to send out information on what our, what's going on with our finances, particularly the $43,500 community board enhancement initiative. And I think the last time I asked the question, Ebenezer said there was still a $30,000 balance. And then it came up at one of the executive committee meetings that they were thinking about like getting more CB12 swag, and they're trying to decide what to do with that money. I've been trying to communicate by email and have gotten no response. And I think there are things that we can actually spend it on. And one of the ideas that I wanted to explore is whether we wanted to set up in pharmacies and that kind of stuff, mass distributions. Because I do think up here, everyone's bitching on Facebook that it's just ignorant people who refuse to use masks, but I think it's also an economic issue. So I wondered if there's a way that we as a community board could pilot a project using some of those funds will otherwise go unspent to distribute masks in our neighborhood.
On the YouTube, you can easily make a mask out of a bandana and 2 ponytail hands. You just fold the bandana and then fold it. So
I think if I could, sorry, Barbara, just to Sally's point.
Go ahead.
Okay. You mentioned before too, pharmacies, and I think that's a good idea, but I would also say, because I know if I don't have to go to a pharmacy, I'm not going to step foot in there because that's where a lot of sick people are, right? Like they're going to get medications if necessary. And they're usually the ones up here that I've been to are usually very small and have small aisles. So like maybe, like bodegas would be, better or
other locations. It just needs to be a location, I think, where someone actually has eyes on it so they don't get emptied out. Like you're limited taking, a handful. But I really do think it's a huge issue in our neighborhood. And since we do have the funding available, and I'm sure that, I've looked up some distribution, machines that you can easily install. And I'm sure that we could look at what they've done at what they did at New York Presbyterian Hospital. But I think that would be a benefit to our community. It might address some of the unmasking that's going on. So I just wanted to throw that out there. And also, Steve, if you could check on whether, what the availability funds are, because I would hate to see us return money to the city or spend it on for example, a computer system that will never be used. We could also use some of the money for flyer distribution, hiring kids to, put flyers up about some of the things that, about the testing and that kind of stuff. So just throwing it out there.
Well,
We've got what,
I
26
think you should
days?
bring it up at an executive committee meeting.
Well, something, I
Okay.
just wonder at this point whether the time period to even spend the money may have passed.
No,
whether or
the money expires or gets returned the last day of the month.
No, I know, but I know that my agency, for instance, has been told that we can't like submit any vouchers. They put a stop on our being able to order things some time ago. So I don't know whether that applies to the community board or not. But I certainly don't want to see the community board spend money on things that are not necessary and on swag, as you put it. Although I tell you, I wouldn't mind it if we were passing out masks that had the CB12 insignia on it or something. That might be another way to let the community know that we exist.
Yeah, that's true.
But
I think that would be a really good use of funds.
yeah, no, I think it's an interesting idea. I wouldn't. I'll bring it up, but I don't have too much confidence that we would be able to pull it off.
Well, I'm willing to volunteer.
Just a quick
to
time
help
check.
pull
It is
off.
9:30.
Yeah. Okay. Natalie, is that your hand?
Yes, no, I just wanted to make a little announcement if you're still doing new business.
No. No. Announcements come after new business.
Oh, is that it?
Yeah. Please
My
don't violate our procedures.
Heaven
And by the way, there was a great presentation. Gail did an Uptown chat with the We Act tonight. So if you have a chance to view it on their site, it would be worth listening to.
Well,
I think that's an announcement.
No,
sorry.
no, I don't know.
Out
No,
of
no,
order. I guess it's
no,
all
no,
business because it ended a couple hours ago.
No. If she had told us that it was going to take place on a future date, that would have been an announcement.
She did talk about
Just
pooling
superfluous.
Yeah, I mean, how could you see it if it was tonight?
Because it started at 6 o'clock.
At a reasonable hour.
Oh,
Yeah.
okay, very good. All right.
Yeah.
All right, very good. Anyone else? Okay, we're now on
Hey,
to
wait,
announcements.
Steve, I do have one new business thing. If we're going to keep doing this virtually, can we start them earlier? There's no reason for us to start at 7 o'clock.
That's okay.
At least 6:30.
Okay, but actually, this gives me an opening. Is the committee willing to meet to have another meeting in July?
Yes.
At 6:30, yes.
Okay, I'll compromise at 6:30, but because I do want to get that presentation about the mental health initiative from Columbia. So,
But Steve, not the first Thursday in July, because that's like July 2nd.
no, I gave them July the 9th.
Okay.
Oh, shoot.
The other item of new business.
Did Steve
no,
fall or
hold-
just his computer?
No, one second, I lost my phone. So is Tanya okay with meeting on July 9th?
Yeah, that's fine with me. And at 6:30 is fine too.
Okay, Daryl is okay with it. Sally, are you okay with it?
Yeah, I'd love it.
Barbara Frazier?
I can't wait.
Oh boy, I can't believe how excited I can make you. Jay Mazer, are you okay with it? All right, well, I decide we have 1, 2, 3, 5 in favor. So that's what we'll do. Okay, very good. July the 9th at 6:30.
Bye.
Okay, we're on to announcements. I recognize Ms. Espino.
Thank you. I actually am not going to take up much time since I joined a few minutes late because I was still on the Borough President's Arts Teleconference, and I heard a lot of the things that are in our newsletters being spoken about, like cooling centers and testing sites. But I will point you to the fact that in today's Gale Brewer update, are links to the Google Doc of the entire list of free testing sites in Manhattan put up by the Testing Project, and then also the Castlight Health map tool if you are looking to find them plotted on a map so you can plan your commute to your exciting COVID test. And that's pretty much it. Every other event that I could have announced either happened earlier today or was happening concurrently with this meeting. So look at social media and see the replay, like Sally said, of the WEAC meeting or the arts chat, wherever you you cross paths with the big, rich Gail Brewer agenda right now. And I salute this committee in particular, since you are dealing with not only a global pandemic, but also some very difficult questions on violence in the community, specifically police violence, specifically against Black bodies, and how they are. This is in and of itself a public health crisis. So we're here to support you as always.
Thank you for choosing us, Natalie.
Yes, thank you for joining our meeting. Okay, and Sally, is that a hand?
Yes, I want to bring up something else since we're talking about mental health and at the next meeting, Fountain House, which is helps support people with serious mental illness, bipolar schizophrenia, major depression, has houses in the Bronx and also in Hell's Kitchen that services residents from our communities. And they've established a virtual Fountain House. They're still providing the same help with education, return to school, employment, housing, etc. I wonder if it would make sense for maybe someone from there to present on what they do, because they have an amazing network now, expanding it virtually, and they're still accepting new members.
But don't they also have a residence on Amsterdam Avenue between 172nd and 173rd?
They have, I don't know where the specific locations are, but they do have supportive housing in a lot of communities.
Yeah, well, I remember approving a request of theirs to locate it on Amsterdam Avenue. I'm sure it's still, I believe the building is, the residence is still there. So yeah, I would be open to having a presentation from Fountain House. Absolutely. I was recently at
great.
I think I was recently at their main facility on 46th Street. Was it?
Second, 47th. Sorry.
47th. Yeah. It was
47th between 9th and 10th.
Yeah, it was pretty impressive.
No, it's beautiful.
I had a community board 4 meeting there. Okay,
yeah,
okay.
That's what I was going to guess.
Okay. Anyone else?
Maria.
All right.
Maria Luna.
WEAC membership meeting, second week.
Okay. But does Maria Luna have a final word?
Yeah, very briefly, due to the disturbances happening in our community, unfortunately, I was informed that 2 pharmacies were totally destroyed and the records are nowhere to be found now. You know that some of the seniors especially depend on having the prescription filled and everybody else. I don't know if there's some way that they can be helped. The pharmacy on 177th Street and Broadway, San de Jesus, don't remember the name, is on the corner, and there is one also in Dykeman. All the computers, all the records were gone. So that is a crisis for people who probably have a prescription that was supposed to be filled and now they're gone. So
I think I saw one on St. Nicholas Avenue in 190th Street.
okay.
I don't know how badly it was damaged, but it was the Asbel pharmacy was also broken into. Yeah, those are, you don't think they had any kind of computer backups for that information?
I have no idea. It just happened yesterday, the day before.
Oh, yeah, I know. God, that's awful.
Yeah.
If there's no way to retrieve any of those records.
I will also add that the Rite Aid here in Inwood was vandalized, putting them out of commission for a few days. It's undetermined when they'll be open again. Of course, as a major chain, they probably have centralized storage of those records, but it is still something where I had to call the corporate Rite Aid there because the local outgoing message didn't say anything about the fact that they were temporarily closed. So none of the seniors in the neighborhood who get their stuff there had any idea what their next step would be.
Where's that
Where-
Rite Aid, Natalie?
Is it,
That is at 4910 Broadway next to Seatown.
so just south of 207th Street?
Correct.
Okay.
And it's a 24-hour store. And if,
And that was broken into?
I don't know if it was broken into or smashed. They
Oh,
had
God.
the gate rolled down all the way.
Jesus.
And then when I had to, like I said, call, and also the one on, further up in Riverdale, 238th, but they had actually put information on their outgoing message that helped me connect the dots with corporate.
I can say that Rite Aid does have, I get my prescriptions at Rite Aid, and they do have all of their prescriptions on a database. You can go to Missouri or to Alabama, and they'll be able to look up your prescription.
Yes, it is a different story on a chain, but it's a
Yeah,
question
yeah,
of how our
right,
particular local
right.
store are communicating to the seniors and well, to the
Right.
customers in general.
Yes.
But
No, it's really tragic when these individual stores especially are hit. It's a tragedy when any of them are hit like and looted. But when these individual mom and tops type operations, everything they've invested could be lost. All right, I think that brings us to the end of the meeting. So I'm.
Motion to adjourn.
Okay, thank you. What is it, seconded?
Second.
Thank you. We're now hearing no objection. We're going to be adjourning now at 9:41, and we will meet again on July the 9th at 6:30. Thank you all.
Thank you, everybody. Have a good day.
Bye. And
Bye.
Tanya.
Till
we'll
next
talk-
time.
Bye.
Yes, I'm going to touch base with you, Barbara, okay?
All right, bye.
All right. Bye.